Some highlights of our Health IT program. All of our certificates are non-degree. This is a 6-month training program, and all of our courses are non-credit. Each course equals out to about 30 to 35 hours. So the courses are non-credit, but they equal 30 to 35 hours. Like I said earlier, everything is delivered online. We knew that we would have a majority of our students that would not be located in Devils Lake, North Dakota. They would be located across North Dakota, across the United States. We've actually had students enroll from Chicago, Illinois. We had a call from Maryland yesterday. We've had calls from Atlanta, Georgia, Texas, across the United States. And we are also actually working with the state of Wyoming right now to offer our Health IT program to students in Wyoming. And so we knew when we were developing this program, we would have to make it accessible to students at distant locations. And so that's why we chose to offer everything online. Everything is in 8-week terms. So when a student starts the program, they are required to take 3 consecutive 8-week terms for a total of 6 months of training. New students are able to enroll at any time during the year. At the beginning of any term, a new student could enroll. There is tuition assistance available, and I will talk a little bit more about that. There also are CEUs available to students who are professional nurses. We have CEUs available for them. And there are also CEUs available for AHIMA certified students. And our instructors are very, very knowledgeable in the use of electronic health record systems. All of our instructors have actual hands-on, years and years of actual hands-on EHR experience. So I'm very proud of the faculty that we have teaching the courses for us at Lake Region State College. Lake Region is the only community college in North Dakota offering a health information technology program of this kind. And we are one of only 84 community colleges in the whole United States offering this program. So we felt very fortunate that we were able to receive this grant and offer this program for the state of North Dakota. I've also heard feedback from a number of students when I was talking to them about how much time do they put into the courses and how long, how much time is out of their daily work week. They did say that one of the most beneficial parts of this program, not only do they get the actual hands-on experience with the EHR system, but the networking that they do with the students in their classes has been very, very beneficial to these students. When they start discussion questions going, they get feedback from everybody in their class, and so everyone has different stories to tell and different ideas on how to go about doing things, different solutions for different problems. So I've heard that the most beneficial part of not only the curriculum, but a beneficial part of this program is the collaboration and the conversation between the students. So I was very excited and very happy to hear that. Especially in an online environment where they don't get to see each other face to face, I was happy that students are conversing back and forth on a daily basis. Next slide, please. The next slide is the cost of the Health IT certificates. Each certificate that we offer, all 4 certificates, are $2,700, which basically breaks down to $900 per term. Right now, we have tuition assistance available for the first 75 students who complete our program. They would receive the 3rd term free upon completion. So they would pay $900 for the first term, $900 for the 2nd term, and they would receive that 3rd term free upon completion. And the reason why I stress completion on this slide is because when we received this grant from the ONC, one of the requirements was that we had 300 students enrolled in this program by March 31st, 2012. That's when our grant ends. We had to have 300 students enrolled, and of those 300 students, we had to have 80% of those students complete the program. So we need to have 240 students complete this program by March 31st, 2012. So we wanted to make tuition assistance available to students. Because this program is non-degree and because it's non-credit, they are not allowed to apply for financial aid or grants of that nature. And so we used grant money that we received for this program to give back to the students to provide tuition assistance for them. And so as opposed to giving the students money up front and saying we'll pay for your first term, we decided to have them complete the first 2 terms and then tell them we will pay for their 3rd term if they complete the program, because we do need to stress the completers in our program. And another promotion that we are offering right now is the buy one, get one free promotion, which ends March 31st, 2011. So basically, right now, a student could enroll in our program and get the third term free. And also, if they have a buddy that they're going through the program with, they could pay for one certificate and get the next certificate for free. We have a lot of smaller clinics and critical access hospitals in North Dakota that are taking advantage of this buy one, get one free promotion. So they pay for 5 employees to go through the program, and they get 5 more employees to go through for free. Next slide, please. The next slide just talks about when the terms begin. Our next term begins April 4th, 2011, so that's just coming up in a few weeks. And like I said earlier, new students can enroll each term. Term dates are available on our website, LRSC.edu. And actually on the website, it will give you the start date and the end date. And so you'll be able to see how the term lasts 8 weeks. You'll be able to see the date that it starts, the date that it ends. And you can use that for planning purposes if you want to look at 3 8-week terms and when you'd want to take the courses. Like say you want to start April 4th, you'd go through June 6th, and then August 1st is when you'd start your next term date. So you could use that website for planning purposes if you were looking to take the Health IT program. Next slide, please. The next slide is the registration process. We do require students, when they are serious about registering for this program, obviously they have to have a healthcare background or an information technology background. And so we do require students to complete a pre-assessment, which is a series of healthcare questions and information technology questions that the students need to complete. They complete that and submit that completely online, and that comes directly to us. Once we receive that pre-assessment, we contact that student to let them know if they should be sending us their resume and their official transcripts. Because we look at the pre-assessment, we look at their resume, their prior work experience, and we look at their transcripts to see what coursework they've already taken to make sure that they are qualified to pursue the Health IT certificate. Because as I said earlier, this is not a degree program, this is a 6-month workforce training program. And so students need to have a hefty background in either healthcare or IT in order to pursue this Health IT certificate. Once students complete the pre-assessment and send in their resume and transcripts, we contact them. They're able to complete the registration process. We invoice them. They send us their payment, and we enroll them into our online platform, which is eCollege, and they are able to start classes on the day that the term starts. Next slide, please. The next 3 slides are just information regarding our office on campus at Lake Region State College. Debbie Lee is our program assistant. She can answer any questions that you have regarding the enrollment process or the registration process. Next slide, please. Lindsay Vanthony is our student recruitment and retention specialist. She could answer any questions that you have regarding the coursework that you might be taking or when you be starting classes. Next slide, please. And the last slide is just my contact information. Again, my name is Cindy Brown. My email address is on there. My phone number is on there. I can answer any questions that you may have regarding this program, or if you'd be eligible to start the program, or if you have anybody in mind that you think might be interested in the program, please feel free to give them my name and contact information. I would appreciate it. Is there any questions from any of the sites?